This is a contrast NAN CT scan of a 27-year-old male patient. He is a known case of right renal calculi. Percutaneous nephrolithotomy was done about a month ago. Since then, the patient has got fever, pain right lower abdomen, and a discharging sinus wrong right posterior abdominal wall upon which a colostomy bag has been applied. Now please see his right kidney. These are multiple calculi lying in the slightly dilated collecting system. Now this is the site of the surgical intervention. Multiple calculi are present in the collecting system as well as in the renal parenchyma and in perinephric space. Hypodense areas are present in the lower and middle parts of the right kidney. These are suggestive of focal areas of pyelonephritis. Now this is a fluid collection here in right perinephric space. This is suggestive of its being abscess. It shows thin marginal enhancement. This one here. Fluid attenuation areas are also present in the pararenal space. This one. There is an oblong irregular area of fluid collection suggestive of its abscess, showing thin marginal enhancement. This one here. Extending downwards. Another this fluid collection. Now this extends downwards. And communicates with a large abscess in the pelvic cavity. Please follow this here. Now this is a large abscess here lying in the pelvic cavity. Please observe thin marginal enhancement. A small locus is present on the left side as well. Now air lucencies are present in some of these loculi. Upon surgical notes, it was mentioned that there was trauma to the ascending colon during the surgery. Now it is always wise and mandatory to describe the location of the ascending colon as well as descending colon while commenting upon CT IVUs or plain CT KUBs. Now since this lies along the lateral side of the right kidney, so this got perforated. Now this is the site of the sinus tract here. This one here. Now air lucencies are present in these abscess loculations. So its communication with the ascending colon cannot be excluded. The other possibility could be that it is a gram-negative abscess giving rise to the cystic lucencies, but considering the previous history of trauma during the surgical procedure, the likelihood is that there is communication of the abscesses with the ascending colon. DJ stent has been placed. It is functioning fairly satisfactorily. Now please observe the marginal enhancement of the renal pelvis. These all are the sequelae of the infection. Now this is the left renal pelvis, which is extrarenal and baggy on left side. There is no enhancement of the wall of left renal pelvis, but on right side you find this enhancement of the wall of the renal pelvis. This is suggestive of the inflammation. So there is a perinephric abscess, fluid collection in the paranephric space. and irregular oblong abscess which extends along the right lateral abdominal wall and extending downwards into the pelvis. Its main component lies in the pelvis. This is the coronal scan. Please observe this pelvic component of the abscess communicating with the abscess along right lateral abdominal wall. There is subacute small intestinal obstruction due to the adherence. Now please observe that these are the dilated segments of jejunum here. I will show you these again in the axial scan. These are dilated jejunal segments. These are the dilated jejunal segments. These are suggestive of subacute small gut obstruction due to adherence.